Welcome to the BioNexus Health podcast with Dr. Jodie Dashore, who holds a Ph.D. in Integrative Medicine, is board certified in Integrative Pediatrics, an internationally recognized pioneering clinician, and author. And now here's your host of BioNexus Health podcast, Dr. Jodie Dashore.
Hey everyone, I'm glad you could join me today for Autism Uprooted. Actually, this is once again a podcast for everyone. With winter upon us, now is the time to discover the incredible powers of natural and herbal options. Many of you have requested me to share what I usually do for Brian and my family with a cold or a flu. I've already counseled many of you individually during your appointments because I haven't had a chance to do a podcast until today. And why? Well, because we all got this year's dreaded flu as well. We all recovered well, of course. This year's flu in the United States, and from what I hear across the pond and many other countries in the world, is exceptionally strong. Upon testing, many patients have come up with type A and type B in the same organism. So it's been pretty strong with a lot of symptoms. It's been taking a while to get better. So don't lose patience and don't think it is unusual if it takes, a couple of weeks to kind of get back to normal. Okay. Now, what I thought I would do is one by one, I will discuss the symptoms, and then, we'll discuss options, right? I mean, pretty much, again, remember, this is what I do for my family, and I'll give you all of those options. You're more than welcome to follow a similar protocol, right? If you need any individual counseling, like I mentioned earlier, I'm happy to schedule an appointment for you. Just contact my scheduler, and we will, if you have an upcoming appointment, right, we can always prepone it, no problem, or we can squeeze you in. Anytime you need support or you need an appointment, just reach out, okay? In fact, I'm going to make again, a lot of you have reached out and requested that I make the 15-minute appointments available again. So I will be making those available again soon. I guess Monday onwards, let's just make them available. If it's going to be helping people, and if you are able to keep track of the 15 minutes, because what happens is these appointments kind of get booked back to back, right? Because there is one chunk of the day when I set aside, actually my scheduler sets aside that if there are 3 to 4 people that need a brief appointment, then they're all back to back. And if I get behind, then I get really behind with my regular appointments. So that was the reason why I had discontinued those for a little while. But I think I'll open them up again, right? A lot of people are reaching out for that little bit of extra help. All right, so let's proceed. Let's talk about the first one, right? Fever. Now, please keep in mind, fever is a sign of an intact immune system. An occasional fever, of a few degrees is an indication that the incredible mechanism, that is your immune system, is functioning optimally to fight off any foreign invaders. And that obviously helps with a faster recovery, right? Because it is the invaders, the viruses, the bacteria are being handled by your own immune system. Think about it. How many of you during your first appointment have reached out to me, and mentioned that, I don't remember the last time my child had a fever. Well, now your child has a fever. So don't run to the pharmacy and grab an antipyretic, depending on what part of the world you are in. BioNexus is in more than 85 countries. So there are many names for fever reducers, right? There's paracetamol. There's, of course, Tylenol, ibuprofen. Ibuprofen is available everywhere. So don't be in a haste to reach for that ibuprofen just to, boom, let's bring the fever down. Why? So fever is a sign of an intact immune system. Second, fever is deadly to pathogens, to bacteria, to viruses. Yep. So never fear a fever. However, if your child has a history of seizures, then it would be best to keep a close eye on the fever. Now, usually what we do is if up to 103 degrees, 103, even 104, I remember when Brian had chickenpox, the fever was up to 104. What we usually do is to give cold compress, ice chips, stay hydrated, a lot of rest, massages, some eucalyptus oil and peppermint. So eucalyptus and peppermint essential oils can be mixed with a carrier oil, 10 drops of eucalyptus essential oil and 10 drops of peppermint essential oil. Mix it in 1 teaspoon of carrier oil, like, for example, coconut oil, and rub it on the feet, right? A cold compress the back of the neck and on the forehead is another good option. For us, we've been, that's pretty much what we have been doing as well for the fever. Now, homeopathic remedies like belladonna, 30C or 30X, whatever is available where you are, 5 pellets, 3 times a day helps. Now, if a child seems scared of the flu or of the fever, because if the child hasn't had a fever in a while, like most of our autistic children, have an under-functioning immune system and you haven't seen a fever in a while, the child might be startled or scared. Then Aconitum napellus or aconite is the homeopathic remedy that can be used with the same specifications, meaning 30C, 30X, and the same dosage as belladonna that I mentioned earlier. Additionally, increasing the dosage of hemp oil or adding hemp oil, CBD oil, 4 to 5 pumps 3 times a day may also help to settle the child to a calm state. So a little bit of fever is absolutely fine. Now, remember, this does not mean you stop monitoring the fever, right? If the child is uncomfortable, other people in the family are also sick, and everyone just needs a break, for example, it's perfectly okay to use some medication if needed. So the last time, as I mentioned, when Brian had chickenpox, his fever was up to 104. We were okay. Then it went up to 105, and he was quite uncomfortable and in a little bit of pain at that point as well. So I decided to give a low dose of dye-free ibuprofen. I usually go half the dose of what's recommended, and it seems to work for Brian. You'll have to try it out for yourself, because remember, we are doing a lot of herbal support, right? Herbal support, supplement support. So what I find is that a full age and weight appropriate dose, as indicated on the chart on the medication bottle, is sometimes you can easily get away with a low dose, because NSAIDs, right? Like ibuprofen is an NSAID, so it's NSAID is a non-steroidal anti-inflammatory drug. So that can cause GI issues, right? GI side effects in the gut. So it's best, sorry about that. I forgot to put my phone on vibrate. Just 1 second. Let me just turn that down. Sorry. All right, there we go. Notification won't bother us anymore. Always busy, right? That was actually the notification for my next appointment coming up soon. But anyways, let's proceed. All right, now, very important. If your child has a history of epilepsy, seizures, always keep your neurologist in the loop, okay? All right. Let's go to the next important point. When you have the flu or the cold, preventing spread. This should actually be the first point, right? So how do we prevent the spread? What do I do? Usually, just like I have highlighted in the travel podcast, I just use Formula 2 essential oil blend, and I use it in an essential oil diffuser in the room where the sick child is or the sick person is. And additionally, I make a room spray out of it to avoid spread. Now, remember, the room spray, it can also, it can be used in the room safely, easily. Don't spray directly on a dog if you have dogs, right? Because, it's 11 essential oil blends, and one of them is tea tree oil, and that shouldn't come in contact with the skin of a dog, all right? So usually this doesn't happen, but if you are spraying in the room, then just be careful of that. One other thing that I do is I spread, I ask Brian to close his eyes and I spread around him or myself if I have the flu. Just spread it around. It also helps to prevent spread to the other family members. Okay. All right. Next will be the nasal passages. So nasal passages can be runny, stuffy, congested, dry. You could see nosebleeds. So there is, a few variations there. Usually it is best to start off with using a simple saline. We here in the United States have a brand. It's called as Simply Saline. Now, I'm not endorsing any brand. It's just that, what I'm trying to specify is that if it is just saline, right? We don't want any additives in there, just simple saline, which can be sprayed in the nose. Sometimes saline gel is available in its pure form. So, you can just take the gel on a little Q-tip and rub it in each nostril of the child. Or you could just put it on your pinky finger and rub it in. Remember, if you're using your pinky finger, like many parents tend to do, remember to wash or sanitize that pinky finger, okay? Don't touch any of your mucous membranes. Caregivers should wear a mask. It works really well, okay? The Formula 2 essential oil room spray, individual spray, using it in the diffuser is fantastic. If you're in a rush, you just want to go in or out, hand over a meal. However, wearing a personal mask is an important step in prevention, right? Because, as mom or dad, you are the caregiver and you just have to take good care of your health. Okay, and many of you moms out there are also my patients, and sometimes I see everyone in the family because you're all living in the same environment. So it's important to look after your health. And I have given you, individual options for your personal immune support. So please follow those. Just because the child is ill and you're busy, don't forget that not only can you stay on the full BioNexus protocol for the child, you can also stay on your full BioNexus protocol. Don't forget that. Okay, and don't forget to eat and relax. Don't be anxious. Keep smiling. Because, it's just the flu. It will pass. Plus, you have the world's, topmost herbals at home. So just remember that, it's all good. All is well. All right. nasal passages, right? So first you are moisturizing the nasal passages with saline. Second, many of you are already using Formula 1 NSP, which is antimicrobial. So that is, again, an important step. If Formula 1 is being used, then obviously the level of infection is going to be low. You can also use a neti pot with warm water, and there is a special salt which can be used in the neti pot. So depending on how cooperative your child is, often when the congestion is pretty bad, that's when neti pot with like lukewarm water can help flush things out. Okay, all right. Now, one tip here: using a little bit of Formula 1 in the neti pot also works really well. Okay, let's go on to sore throat. So sore throat, again, if you've been using Formula 1 NSP, then you have, for your child or whoever is sick, let me just put it that way, then remember that Formula 1 NSP is pretty heavy duty, antimicrobial. It kills viruses, bacteria, fungi, biofilm. So your level of infection will already be low. So if you do get a sore throat, then the first thing to do is warm salt water gargles, if possible. Now, it's not possible for all children to be able to follow directions for the warm salt water gargles, right? Gargling is a skill. And the salt needs to be substantial. It doesn't have to choke, but it needs to be like, pretty salty, right? To help with the sore throat. So you can do warm saltwater gargles 2 to 3 times a day easily. Now, if that is not possible, then you have the IS throat spray, the immune support throat spray from BioNexus. That is something that can be used as well. Okay, so we talked about fever, how to prevent the spread. We talked about nasal passages. We talked about sore throat. Now let's talk about ear infections. So ear infection will be, you can use the colloidal silver drops that we have in the store. So silver drops, 2 drops in each ear, 3 to 4 times a day when there's an active infection works well. Mullein oil with garlic, if available in your country, that works as well. It should have directions on the bottle itself. Formula 1 NSB, if you want to transfer a little bit into a clean and washed dropper bottle and use those drops, it is very antimicrobial. It works really well. I've heard this from many patients, right? One tip about Formula 1 NSP. Now, nasal spray can also be used with a dropper. If the child is cranky and the nose is stuffed and whatnot, and doing a spray doesn't seem to be an option, then you can always go in with a clean dropper and just use the dropper. It might work better. Okay, what is next? Next will be cough. So cough with or without mucus or phlegm. It can be with or without, right? Usually in the beginning, it's like dry cough, and then towards the end, it becomes it becomes a little more productive. Natural cough syrup with mint or menthol is very helpful. Remember to read the ingredients, right? You don't want to see ingredients like high fructose corn syrup, red dye, blue dye, whatever green color dye in it. No, should be dye free. And speaking of dye-free reminds me, I did not mention with ibuprofen, but if you do decide to do ibuprofen, try to get something that is completely dye-free. Those options are available in the United States. I'm not sure where else it is available. So just please keep that in mind, right? Because red number 40, red number 20, blue number, I forget the number now. But these are all have been clinically shown in studies to be triggers for PANDAS type symptoms. So, and they are neurological toxins. So as much as possible, avoid those. If you cannot avoid, don't get stressed, because if you have been able to keep up with the entire BioNexus protocol, you already have binders in there, right? So you have binders, you have detoxifiers, so it will get detoxified, no worries. All right. Organic cough syrup is always preferred. We have options here, but if you have those options, then by all means. I know in Europe, those are options, right? I've seen in countries like UK, Germany, Austria, Switzerland, Finland, Scotland as well. These options and organic natural herbal cough syrup with mint menthol flavor is available. Okay, now, one thing that I have observed is when you have a stuffy nose, when you have a sinus infection, when you have an ear infection, toothache, more than one tooth, and it could be a couple teeth, that can happen as well. So if you have a child that is cranky and you've tried everything, it is inexplicable what is going on, or you have some indication, it could be extreme sensitivity in the teeth or actual pain in the teeth, right? So remember, you can use the dental health formula 5 DHP extra strength. That can be used. And the instructions, message me and we will send you the instructions on how to use that for a toothache. And now, to keep it simple, what we can do is take a few drops on your fingertip and just massage it along all of the gum lines and the biting surfaces in the mouth. Okay, all the gum lines. Remember, you have the outer gum line, the inner gum line in the lower jaw, and the outer and inner gum lines in the upper jaw, as well as the teeth biting surfaces. Those have to be rubbed in. Additionally, a little bit of turmeric powder can be mixed with formula 5 DHP. And if there is a specific spot that is the problem, you can pack it in there. You can just leave it in there, right? Everything is beyond organic, right? Biodynamic, and turmeric powder, be sure that it is also organic. So it's all good. It's food grade. Okay. All right. Now, the BioNexus online dispensary store has everything you need. And, as we know, all clients have access to that. And so based on what many of my patients are already on, so you should have it with you. Let's talk about those specific blends and what to do, right? When you have a flu or cold. All right, so V blend, virus blend, MPS blend, SS blend, IS throat spray, Formula 1 NSB nasal spray, zinc drops, vitamin C powder. All right, so these are, of course, probiotics. So these are all, this is the list of the specific formulas and blends that are extremely useful during flu and cold. The others I've already mentioned, right? The essential oil blend I mentioned and gave you specifics. The dental formula 5 I mentioned and gave you specifics. So let's talk about these. The V blend, MPS blend, and the SS blend. These three, you can, typically what's needed is double the dose and the frequency. That is preferred, okay? So doubling the dose, so whatever your child's protocol or your protocol is, double the dose. So say, for example, if you're doing, 5 drops twice a day, then you will do 6 drops 4 times a day, okay? Now, you don't have to exceed more than 5 times a day, okay? Usually 4 times works well. So many of you have a dosage of 3 times a day already. So you just have to add in another dose. So you're increasing the frequency from 3 times to 4 times a day. And you will have to double the number of drops. So if you're doing 5 drops, you will double it to 10, okay? But yeah, don't exceed more than 4 times a day. The same for MPS blend and SS blend. The same will apply. Double the number of drops and increase the frequency to 4 times a day. All right, okay. Now, the IS throat spray, you can use 2 sprays 3 to 4 times a day as needed. Brian tells me it helps right away to calm the throat down. So, all right, now the zinc drops that we have in the BioNexus store, right, dispensary, those drops, that will be, so the zinc drops, you can go up to 20 drops twice a day for the first 4 days. Okay, and after that, reduce it to 10 drops once a day. All right, so for the first 4 or 5 days, you can do 20 drops twice a day. Moving on to the vitamin C powder. The one that's in the store is beautiful. It's already buffered. So it's nice and safe to consume, and half a scoop twice a day for the first 4 or 5 days, while the flu is in full swing. And then you can reduce it down to half a scoop once a day. Now, a little bit of orange juice is great for that extra vitamin C. You can keep up with the probiotics. No need to increase the probiotics, just the usual dose is fine. Because remember, you're trying to keep up with the BioNexus protocol as much as possible, right? Okay. Now, if you decide to do antibiotics, then please do reach out to the office so we can advise you on proper probiotics based on the antibiotic being used. For example, amoxicillin will need a different probiotic approach and gut support if amoxicillin is being used versus if augmentin was being used, because then it will need something different, right? Now, let's talk about excessive cough and nebulizer treatments. So this is the medical nebulizer that is used for asthma treatments, with the mask and whatnot. The compression type nebulizer, right? Which ionizes the medication. So this is like medical nebulizer used for asthma treatments. So that can be quite helpful. I'm not speaking about medications. I'm just speaking about the machine itself, right? Now, in that medical grade nebulizer, it has a medicine cup. Now, in that medicine cup, isotonic, or even better than that, is hypertonic saline, 3 ml to 5 ml sterile vials. Sterile vials are available. So 3 to 5 ml will depend on the size of the medicine cup of your particular nebulizer. That is great. That works great for nebulizing. For a deeper cleanse, 5 drops of silver is a good option if you prefer. Now remember, the products that I'm mentioning, silver and the herbals, the blends, the zinc, the vitamin C, these are the ones that I use, the ones in the store. Okay, yeah. So that, we don't make any mistake about dosage. Right. Now, Ayurvedic golden milk, of course, plant-based milk, non-dairy. That is a great option, right? Warm as tolerated. Then you add the turmeric in and have the child drink this a couple times a day. Ginger and clove. Boil fresh ginger and clove in hot water and simmer. Once it comes to a boil, simmer for another 10-15 minutes. You can even put peppermint leaves in there, right? Mint leaves. It doesn't have to be peppermint. It can be just mint. Just break up the leaves and put it in there. If you have tulsi available, depending on what country you're in, this is holy basil. In fact, regular basil is fine as well, right? It all belongs to the same family. But if you have holy basil, especially holy basil with the purple stems, those you would also rip up a few leaves and put it in the hot water. So you are brewing a tea. Obviously, no caffeine. Again, for people from those countries where tea means your regular tea leaves or chai, that's not what I mean, right? This is just literally brewing in hot water, just the ginger, cloves. Now cloves, not too many, okay? So if you're brewing, let's say 2 cups, you will put in 2 cloves, you will put in 1/2 inch of ginger. You can, of course, add 1 teaspoon of turmeric. If you have fresh turmeric root, that's even better. 1/2 inch of fresh turmeric root, 2 leaves of mint, and 2 leaves of tulsi or basil. Holy basil or just basil. This, bring it to a boil, bring it down to a simmer for 10 minutes, cool it down, or, actually warm is better. Yeah, warm is better. You can add some honey in there and you can give it to your child. It's very soothing for the throat. You can use manuka honey and a few drops of fresh ginger juice. Take a piece of, and obviously everything organic as much as possible. So take a piece of ginger, put it in the lemon juicer itself, and you'll be able to squeeze out a few drops of juice, not more than a couple drops. It's pretty strong. So scoop out the manuka honey in a spoon, add a couple drops of the ginger juice, fresh one, okay? Don't buy the ginger juice available in the stores, even if it is organic. No, this has to be fresh. Because, the fresh one releases more of the active compounds and the oils which are needed. And just have your child take that from the spoon itself, okay? All right, now diet. Remember, reduce fats and heavy food. Use light, liquid, easily digested foods. I mentioned the Ayurvedic turmeric golden milk. Khichdi is easily digested. Bone broth, vegetable soups, soup and rice, chicken noodle soup, are all excellent options. All right. Okay. So I think I've covered everything. In case I haven't, feel free to just send a question and I'll be happy to answer. Right. Remember, all of these extra treatments, you can carry on not just for 4 to 5 days. Say you have an exceptionally heavy case of cold or flu, then it's okay to continue for a couple of weeks. I mean, it's just herbals and natural supplements. So it's all good. And again, I'm happy to counsel you further if you feel that you need that additional support. Okay, so before I close today's podcast, there are a couple of specifics that I want to go over again, right? The essential oils, 10 drops each in 1 teaspoon carrier oil, mix it in together, right? So now remember, you don't have to finish up that whole 1 teaspoon, rubbing on the feet or rubbing on the chest. Again, on the feet, you can use peppermint, ginger, eucalyptus. And on the chest, you can use the same, right? Rubbing on the chest. You will actually add, instead of 10, you will add 15 drops of eucalyptus if you're trying to make a blend for the chest, rubbing on the chest. If you just want to use, vapor rub, that's fine too. I mean, it's not that big of a deal. Remember, we have plenty of binders and detoxifiers in the protocol. So that's just fine. If there's a headache and you wish to use something like Tiger Balm for your child for the headache, or any body ache, I don't hesitate to use a children's vapor rub or extra strength Tiger Balm if there is aches and pains. It's very important to make the child or the person feel better, right? There's already flu going on, there's some fever, and shivering could also be happening. The weather outside is cold, so you want the person to be comfortable. All right, so keep that in mind. I actually had one mom that thought that the entire teaspoon had to be used. So that was my mistake. I should have specified that you just take a little bit on your hands, a few drops, and then massage the chest or rub it on the feet. Now you can do this a few times a day if you have a time. Another thing I forgot to mention is, let's see, essential oils. Yes, the cough syrups that are available locally. Maybe I did mention this, but anyways, I'll say it again. The cough syrup, again, look at the ingredients and try to get mint or menthol flavor, because that helps a little bit better. Okay, mint or menthol flavor would work well. I did say that look for organic cough syrups if possible, but sometimes just Manuka honey or any local honey with a little bit of ginger juice. You can also add some turmeric powder to that. That itself helps with the cough quite a bit for some, right? What was the other thing I forgot? One other thing I need to remind you. Just give me 1 second. I'll be right back. Okay, sorry about that. I needed a little bit of water. All right, so moving on to boosting the immune system. Remember, what do I always say? No boosting. Don't start using things like elderberry, echinacea, golden seal would be another one, astragalus. Don't start using any kind of immune boosting herbals, because our kids with PANDAS already have a boosted immune system. It's already upregulated. You don't want to further upregulate the immune system, okay? So use immune modulators. So for those of you whose labs show that the immune system is very low, remember we do labs, right? So you should know what's in your child's labs. So if it shows that your immune system is low, then I already have given you the ISM blend, the immune system modulating blend. I've given you that already. So that is something else that should be continued, which is why I say, continue your protocol as much as possible. Now, some of the supplements that are like bitter or, you have to open the capsule and mix it and whatnot, and you're not able to do those for a few days, that's okay. That's okay. But actually, if you are able to do those, that's going to be beneficial. Additionally, if you choose to do antibiotics, amoxicillin, whatever, and Z-Pak, zithromycin, or whatever antibiotic is prescribed for you, if you choose to go that route, Remember to keep up with the B vitamins. It's very important because those will help keep your child a little stable, right? One other question that I was asked is about heating pads. Now, just a regular heating pad is not a good idea because it's pretty high EMFs coming through. So heating pad is great if you have the right one, which is low EMF and far infrared. Okay, so that is usually an FDA medical device, and it is usually something I need to call in. So I'm happy to prescribe one for you, small, medium, large, whatever size you prefer. So just contact me, and it can be shipped anywhere. So just let me know, and I'll be happy to prescribe one for you. Right? Yes, I believe they offer different kind of voltage levels as well. So an infrared heating pad will provide comfort, will speed up the sweating ability as well. So that's actually good. So just to give you an example, what I usually do with Brian is we use the infrared heating pad and the low EMF one, obviously. And I don't give any fever reducers, and I haven't seen, like I mentioned, Brian's fever go over 104. It hovers around 103, 104. So he just, lays on the heating pad, closes his eyes, watches a show on TV, or, reads a book, or just listens to music. I have some books on tape, actually. So that helps him relax. I give some hemp oil. He's pretty much self-regulating now because he's much older. But yeah, he knows what to do when he has a cold or a flu. And then on the heating pad. So what happens is when the fever breaks, remember when the fever naturally breaks, the body is all sweaty and it feels fantastic. That's what I did for myself as well. This time my fever went up pretty high. I think it was around 104, 105. And I just let it ride. And not 105, I think it was 103, 104, the same as Brian's. And I just let it ride. I don't have any history of seizures and whatnot. So when the fever broke in the morning, I mean, the sheets were soaked, the pillow was soaked, I was sweating. Sweating is a good sign, right? That means your body can detox. And it was great. I had to I had to make sure that the sheets were changed, but you feel so great, when the fever breaks. It took 2 breaks for me. Like 2 nights in a row, the fever broke, and the next day I started to feel great. So that can happen with your child as well, right? Your fever may break. His or her fever may break, and that's a good thing. The infrared heating pad helps with that. So I'm happy to prescribe that for you if you're interested. All right, so these were the points that I forgot. So let's get through this winter. Many of you have actually reported that your children contacting the flu are doing much better than yourself because they are on the full herbal protocol. The kids seem to be recovering really well. Now, those are the kids who are already on the full protocol. However, there are many that are still trying to build up. We know children on the spectrum are sensitive. So many who are still trying to build up. So those might be a little bit more vulnerable to the cold and flu this season. So it's a pretty heavy season. But again, this too shall pass. And I look forward to, hearing from you that everyone's doing well, that you're, having a good holiday season as well. All right. So that brings us to the end of today's podcast. I hope it was helpful, and I look forward to seeing you at the next one. Until then, be well. Keep smiling. Namaste.
Thank you for joining Master Herbalist Dr. Jodie Dashore, Director of the BioNexus Health Clinic and BioNexus Herbals, on the BioNexus Health podcast, where we explore and share information and stories about recovering and healing from chronic and environmental illnesses such as mold biotoxin illness, Lyme disease, autism spectrum disorder, fatigue, Crohn's and colitis, mast cell activation syndrome, PANDAS, and more. Please help us grow our message by subscribing to our podcast channel and sharing the podcast on your social networks. For more information, visit bionexushealth.com.
Information within this video, audio, or text, collectively known as the podcast, has not been reviewed by the FDA. Nothing within the podcast is intended as or should be construed as medical advice. Information is for general informational and educational purposes only. Consumers of the podcast should consult with their healthcare practitioners for medical recommendations. Seek the advice of a qualified healthcare provider. Do not disregard the advice of a healthcare provider based on any information from the podcast. The information within the podcast may contain information concerning dietary supplements or over-the-counter products that are not drugs. Our dietary supplement products are not intended for use as a means to cure, treat, prevent, diagnose, or